Alright, now we're going to talk about cold-related injuries. And they occur when the core body temperature is less than 95 degrees Fahrenheit. And we need to educate our patient when it's cold out to dress for the weather. You know, I'm the mom that sends my kids in a lightweight jacket the first day it snows. Not a good parent, but it happens. You want to educate your patient to add layers. You should keep extra clothing, water, and food in your car, in your vehicle in the winter in case it becomes stranded. My husband keeps some water in the car. You shouldn't diet or restrict food when participating in outside activities because you're burning calories as you're doing it, all those layers. So there's 3 levels: mild, moderate, and severe. Mild, they're going to experience shivering, decreased muscle coordination. When it's moderate, below 90 degrees but higher than 82, they're going to have muscle weakness, acute confusion, decreased clotting. And severe is when it's less than 82 degrees Fahrenheit, and they're going to have acid-base imbalances, bradycardiac, decreased respiratory rate, decreased pain responsiveness. You're probably going to be intubating them. Most likely, in Hannibal, you're going to see mild and moderate. I've never seen a severe. And I love temp sensing Foley's. So put one in, measures their core temperature, and we'll get over that. So, interventions for this. Before they come to the emergency department, we want to go to a shelter, remove all the clothing, engage in rewarming, and then they're probably going to get hospitalized if they have cardiovascular instability. So when they get to the hospital, there's probably moderate to severe hypothermia. When you're giving medicines, you want to use cautions because the metabolism is unpredictable in hypothermic conditions, and that drugs can accumulate without obvious therapeutic effect while the patient is cold. If they're not breathing, you need to remember your ABCs, airway, breathing, circulation. You may need to start CPR. They can go into ventricular fibrillation, so just be aware of that too. You may apply external heat with heating blankets. This initially may cause the temperature to drop in the patient because of peripheral dilation. You want to warm the trunk first before the extremities. Give warm IV fluids and heated oxygen. I've never seen heated oxygen, but I know it is out there. In severe hypothermia, you can treat it with cardiopulmonary bypass. It's the fastest core rewarming technique. It's just not available at Hannibal Regional. They are at risk for ARDS, acute respiratory distress syndrome, renal failure, and pneumonia. And you need to warm the patient up all the way if they're in hypothermic cardiac, because once you get them warm, they may regain a cardiac rhythm. Another cold-related injury is frostbite. This picture here shows edema and blisters formed 24 hours after frostbite occurred. Initially, you're going to see the skin looks kind of white, waxy appearance to the exposed skin, and most likely you're going to see it first on the nose, the cheeks, and the ears, maybe the hands. Risk factors for this include inadequate insulation against cold weather. Skin is exposed to the cold or cold person's clothing offers insufficient protection. So if somebody wore a tank top and it was negative 10 degrees out, they're going to develop frostbite. It can be superficial, partial, or full thickness. It's categorized between 1st degree and 4th degree, with 4th degree being the worst. They can develop full thickness necrosis, and it extends into the muscle and bone. Gangrene can develop, and then we're going to have to amputate that. We want to rapidly rewarm them, but we want to recognize this early. Early recognition begins with warming body heat to the affected areas. So we want to teach our patients or teach EMS to place their warm hands over the affected areas. So if their hands are in gloves, put them over their cheeks that are exposed. If their hands are exposed, we can teach them to put it under their arms, like the SNL cheerleaders. Just don't recommend smelling it. Hospital care. They're in the hospital. We could give a rapid rewarming and a water bath at a temperature of 104 to 108 degrees. Patients can experience severe pain during the rewarming phase, so we can give opiates for pain and IV rehydration, warm IV fluids. We can also give ibuprofen. We want to keep the injured area above the heart to decrease tissue edema. These patients are at risk for compartment syndrome, so they can have some neurovascular impairments. So we want to assess for pain and paresthesia every hour. Frostbite destroys tissue, so they are at risk for tetanus-prone wounds, so we want to immunize them with a tetanus vaccine. And we want to, if it needs and it's opened and they've had surgery or anything, we want to apply a loose, non-adherent dressing. They can use topical and systemic antibiotics. And don't forget, if it's bad enough, they may need to have the debridement of the wound. And then if it's gangrene or they have severe injury, we're going to possibly amputate. Now our little patient has traveled to high altitude illness. They have altitude-related illness. The most common we're going to see is acute mountain sickness. And the other two is high altitude cerebral edema and high altitude pulmonary edema. These three things result of exposure to low partial pressure in the body as a result of exposure to low partial pressure of oxygen at high elevation. Hypoxia becomes more pronounced as elevation increases. Supplemental oxygen becomes necessary at levels above 18,000 feet and non-acclimated people to prevent these altitude-related illnesses. They may show an increased respiratory rate. Their REM sleep becomes impaired when they have it. Okay, so I don't know what that was. So patients may complain of, during our assessment, they're going to have a throbbing headache, anorexia, nausea, and vomiting. They may feel like an alcoholic-induced hangover. When they have high altitude cerebral edema, they're also going to have a lack of interest in things, also known as apathy. And they're going to have ataxia, which is a defective muscular condition. They can't move their muscles. And mental status changes. They may be at risk for seizures. And then with high pulmonary edema, this can happen within the first 2 to 4 days of rapid ascent to high altitude. It's common on the second night if they're climbing like a tall mountain. They can have tachycardia and tachypnea. They can have a persistent dry cough. Lip and nail beds become cyanotic. And they're going to have pink frothy sputum. So as soon as you recognize cyanosis, what should you apply to the patient? Yes, a non-rebreather oxygen mask. Good answers. When their vital signs can vary, their heart rate can increase or decrease. They may have dyspnea at rest. With the pulmonary edema, high altitude, they are going to they're also at risk for pneumonia. So we're going to treat them while they're on the mountain. So first things first, we're going to hopefully whoever they're climbing the mountain with, because you shouldn't climb a mountain alone, you should descend to lower altitude. And as they're descending to lower altitude, EMS shows up, and they're going to give them oxygen via non-rebreather. And then there's acetylcholine. It's a bicarbonate diuretic, and it's going to help treat the altered mental status by removing excess fluid. You can take this Diamox 24 hours before your trip and the first 2 days of your trip if you've ever experienced acute mountain sickness. You want to ensure adequate nutrition and hydration. You also want to make sure you are not drinking alcohol or avoiding it, and avoiding sleeping pills because that can play a part too. The next thing we're going to talk about is drowning. Drowning. This also goes for pediatric patient. Prevention is key. So if prevention is key, the first thing you need to teach your children and all of you is how to swim. So important. If you're going to be around lake, rivers, pools, teach your child to swim. That's my life lesson. So drowning is the leading cause of accidental death in the United States. It occurs when a person suffers from primary respiratory impairment from submersion or immersion in a liquid medium, usually water. We want to health promotion of this. We want to observe people in water, especially those who can't swim. So you never want to swim alone. You need to know the depth of the water before you dive. Obviously, you don't want to dive in a 4-foot pool. You want to avoid alcoholic beverages when swimming and boating and while in the proximity of water because that makes you more at risk for drowning. And you want to ensure that you have water rescue equipment available, such as a life jacket or a flotation device. If you can't swim, don't swim. But make sure you educate your children to swim. When we do our assessment on patients who are drowning, if EMT's there, when they show up, they're going to rescue the victim for us before they show up at the hospital. They're going to gain access to the victim, and they're going to safely remove the patient from the water. Spine stabilization with a board should be considered who are high risk for spine trauma. So if they dived, you want to use spine stabilization. Are there signs of injury or alcohol intoxication? So you're going to assess, as they show up into your ER, we're going to assess their airway. And you're going to ask the patient if they can talk, or the family member, how long were they submerged underwater? And how severe is the hypoxia? You'll probably have to ask EMS that. Cold water seems to have more of a protective effect than warm water. So, we saw that there's that movie out of like Wentzville, Lake St. Louis area. He drowned, but he regained everything. Probably because he drowned in cold water. Aspiration causes surfactant to wash out the lungs, so think of the Mississippi River. That water is disgusting. So there's many contaminants in it, such as chemical, algae, sand, and mud. So just be aware of that. You need to assess the patency of breathing. We need to know what caused the drowning. Was it a medical reason? Was it a seizure? Did they just not know how to swim? Or was it an injury sustained from diving? When they're in the hospital, we may need to do CPR. We're probably going to have to intubate them. We needed a gastric decompression maybe is needed to prevent aspiration of gastric contents. And when we intubate patients now in the emergency department, we usually put an OG or NG down. They may be at risk for acidosis, so we're going to do an ABG. EKGs can show cardiac dysrhythmia. In the end, if it's severe enough, they're at risk for pulmonary edema, infection, acute respiratory distress, and some neurosensory impairment. Patients who drown will be most likely hypothermic, so we're going to warm their skin and give warm IV fluids. Audience response questions. A patient is brought to the emergency department after becoming ill. While hiking, reports weakness, nausea, and vomiting, and severe right leg pain. Blood pressure is 90/60, and the right lower leg has localized swelling and redness. What condition does the nurse anticipate? They're hiking, and they are having severe right lower pain, and the blood pressure is dropping. We're going to assume it's a snake bite. The brown recluse, we can't think it's a brown recluse because that's an ulcerative lesion. A 24-year-old patient comes to the ED with respiratory distress. Next page, sorry. Being stung by a bee while gardening. The patient history includes one prior bee sting. What is the most appropriate nursing intervention? A. Give the IM epinephrine, oral Benadryl, and oxygen. I almost want to give that Benadryl IV in real life, but that was the best answer. Question 3. A patient who was hiking and caught in a blizzard is brought to the ED by friends who report applying dry chemical warmers to the feet. This is why I don't live in the mountains, because I'd be caught in a blizzard, and I don't want to do that. But at least they tried to warm him up, his friends did. The patient is vigorously rubbing both feet. After the ER physician diagnoses his frostbite, the nurse teaches the patient which further outcome. The answer is the possible further tissue damage. Dry heat should never be applied, nor should the frostbite areas be rubbed or massaged as part of the warming process. These actions produce further tissue injury. For all degrees of partial to full thickness frostbite, rapid rewarming and a water bath should be used if possible. Hot towels could be used instead if a warming tub is not available. They are going to experience severe pain. For heat-related illnesses, who's at risk for that? Listen to part 1. We know our elderly patients, our drug users, athletes, patients with mental health, sports people, military, anybody that works outside. Our cold-related injuries, they're going to have frostbite. What are we going to do for that? They might have lots of pain. They're going to need debridement. If they have a lightning strike, what body system are we going to assess first? Cardiac, they may need CPR. We want to do an EKG. They can have that lichen skin shown after it. Snake bites, we're going to contact poison control. They're going to have pain, redness. And that is on page, I believe, 138 of your bike. Yep, of your book for snakes. Remember that venom is toxic, so we need to give an anti-venom. We want to assess if it's a spider bite. We're going to assess the site every 30 minutes. We need to measure their temp every 4 hours. Altitude-related illnesses. What medicine are we going to give them for that? Diamox. Because it helps physiological changes that help the body adapt to less available oxygen in the atmosphere. We can give Diamox. Treats the altered mental status that they experience from climbing the mountain too high. They can have pulmonary edema and cerebral edema, so we're going to watch for their lungs and neurostatus. Drowning, we're going to do some patient teaching. Don't swim alone, have water rescue equipment available. We want to safely remove them from the water, especially if they were diving. Keep spine immobilized. You're going to educate, ask them what caused the drowning and how long were they submerged for. With the altitude-related illnesses, what are we going to do? We're also going to give them oxygen if they're cyanotic and ABGs later. If you guys have any questions about Chapter 9, let me know. I'm going to post Part 2 right now. Thanks.